Hi, I'm Beth with 50 Plus Beauty, and I'm thrilled to be back here with you. For those of you who followed my channel, you know I've been off the channel about 9 months. I've had some family issues, it's been a really hard, grief-filled year. It really has been. But I will get to that in just a few moments. But first, I want to tell you the main event in my life, and that is that about 3 months ago, I had a deep plane facelift with this man, Dr. Christopher Maloney. He's a Harvard trained, board certified plastic surgeon in Tucson, Arizona. You may remember that he did my upper lip about 3 years ago, and he's done many of my family and friends. And this is a three-part video. Part one was last week, and I'll link it below. It was my complete consultation with Dr. Maloney. This is part two, which is my complete day of surgical experience with Dr. Maloney. And part three is a 10-day healing diary where you get to see the ups and downs and all arounds of everything to do with my healing process, which wasn't pretty, but I think it worked out very well. And if you're a hater, please don't hate. Number one, because it comes back to you multiplied. And number two, this is my before picture. And this is how my chin was looking. It was looking really bad. I'd had an under chin lipo years ago, and apparently that scar caused everything else just to sag around it. It was really terrible. And one of the main reasons I went to Dr. Maloney, and I did pay for my facelift totally with my own money, just like I did with my upper lip. I had the deep plane facelift plus a little fat grafting because you may remember I had uneven cheeks from the results of a fat grafting I had maybe 10 years ago that didn't work out well. So I'm really pleased with how it worked out. But the reason I chose Dr. Maloney for my deep plane facelift is I don't like to be put out if at all possible. I've had numerous surgical procedures in my life. I have another one coming in a month where I do have to be put out. I reserve being put out for medical procedures, not for plastic surgery procedures. And the deep plane facelift I had is called the Maloney Deep Plane Facelift. And that is because it is very different from the other deep plane facelifts out there. Most surgeons will put you totally out. Heavy sedation, breathing machine, perhaps that kind of thing, long surgery. Dr. Maloney does not believe in that unless you want it. He will put you out if you want. It costs more money, but he doesn't necessarily recommend it. But in this video, I'll be showing you my complete surgical experience with Dr. Maloney getting the deep plane facelift, but I will be totally awake through the surgery. He does it kind of like when you go to the dentist. You know, when you go to the dentist to get a filling, they inject you to get you numb, and they do that work under a local. That is exactly how Dr. Maloney does his facelifts and basically all of his facial procedures, including my upper lip, is that you're awake through the whole thing. You take Valium in the morning, you go eat breakfast, and then you go in, you get some laughing gas to make the little numbing shots, to make those not bother you. They didn't bother me one bit. And I was awake through the whole surgery. I started the process, as you could do too, with a free virtual online consult at maloneyplasticsurgery.com. Here's a look at that. You just enter your contact information, put your treatment goals, what you'd like to achieve, and then you upload a few pictures of yourself without makeup. I did a front, a side, and a side. And then within 2 to 3 days, you get an email back from Dr. Maloney telling you the procedure or procedures that he recommends and giving you the price. And then if you'd like to go forward from there, you can either have an in-person consult with Dr. Maloney or you can have a telephone FaceTime consult, which is what I did. And basically, you get on FaceTime. He can even do it in the evening. His schedule is very flexible in that way. And you could discuss everything and ask any questions. And so I did that, decided I did want to go ahead with the procedure. We booked the surgery, and Alan and I flew into Tucson, got there about noon. And about 4 o'clock that afternoon, I had a consultation with Dr. Maloney with the surgery the next day. So this is a look at my entire surgery. Okay, it is the morning of my surgery, and I don't have contacts in, so I have these ugly readers on. And I have the four meds here that I was supposed to pick up last night, which I did. And I already took the two Valium at 6 o'clock this morning. I was supposed to take this, it's supposed to relax me, which I kind of need that, I have to say. And then I took the three Keflex, which is an antibiotic that I'll be taking, I guess, until it goes out here. It seems like there's a lot of those in there, but we don't want infections. And I am supposed to just have a sip or two of coffee, and I already did that, so I'm not going to do that again. And I can eat breakfast. That's the coolest thing about having a facelift with under a local is that you can eat. However, I really don't feel like eating. I don't eat a lot in the morning, and I got this little bit of Cheerios, you know? Okay, I'm gonna take one bite, if that's it. Okay, I have eaten for this morning. Okay, here we are at Maloney Plastic Surgery in Tucson. Here's Allie, loyally waiting for me. Here we go. Here goes, I was going to say nothing, but everything. Here goes everything.
Morning, I'm Susan.
Hi, Susan.
Nice to meet you.
See you. Everybody here is so nice. This is Dr. Maloney's waiting room. There he is. So we're just going to wait and start my wonderful procedure.
Here are 3 antibiotics, the 3
Yes,
Keflex, and
I
the
did.
2 Valium.
I definitely did.
Okay. And you have brought your medications with you.
Yes.
You did perfectly.
Awesome.
Have you had something to eat this morning?
Just
a little bite of something?
One a bite.
That's
Just
perfect.
a bite. I was too nervous.
That's fine. Just as something to kind of hold you over for the morning and so forth. And because we've given you some medications,
Yes.
want to make sure that you have something in your stomach. Okay?
Yes.
But under her neck, you can see the issue. She's got a very tight scar band here, and she's really deficient in fat here. She's very thin and athletic to begin with. So we're really gonna try to improve that neck as best we can, but this is a real challenge because she's so thin. Plus, she's got a little bit of heaviness around her jowls. She also has temporal hollowing, and we'll be able to show before and after videos and pictures, but as we age, we tend to lose volume right in here. This is our patient Beth. Today we're doing deep plane facelift, deep plane neck lift, and she's got some jowling here that we're gonna try to contour. And so we're just marking kind of a roadmap of where we're gonna put the fat and what we're gonna do. We're gonna soften her nasolabial folds here. And we're gonna use a retrotragal type of incision that goes up into the hairline over here. So we're just going to be kind of coming around in here. By doing that, she won't have a visible scar here. So that's the retrotragal part that we're marking there. We're gonna come around the earlobe there. We come behind the ear in here. That's really invisible. We've had her take her Valium this morning so that she's nice and relaxed. We're gonna use Pronox inhalational anesthesia, which is laughing gas. And then we kind of point out some things that we're gonna try to do here. This is kind of the deep plane entrance point, that line here. The deeper plane allows us to move this soft tissue like this, whereas the more fixed part of this mass doesn't move as much. Got a nice sharp angle to her mandible here, so we don't need to put anything augmentation-wise there. And other than that, we're gonna harvest a little bit of fat from her posterior flanks because it's a good place to get it. And away we go. Are you ready to go?
Interior flanks?
Nope, it's right back here.
Oh, okay, cool.
This is our Pronox. This is the gas that she's going to breathe this laughing gas, which is nitrous oxide. So it's self-administered. She's going to be able to hold this, breathe it in. It's going to relax her very quickly. So you'll be able to see this in action in a few minutes as she starts breathing.
This is like what you get at the dentist, but you usually have to pay more for.
How are you feeling, Dad?
I am feeling no pain. Yes.
This would be a great video because nobody shows this process.
So she has warm socks on and warm Ugg slippers.
Yes,
Her knees are positioned well. So are you comfortable?
I am.
This is an alcohol to clean the skin everywhere.
I'm a little bit nervous about injection, but
Well, you're going to be on a nitrous, so you're not going to really be with us.
yeah, I let that.
And also the numbing medicine we use is diluted. So it's going to be very, very tolerable.
Yeah. Do you wish I would shut up?
No, we like people that talk.
Okay, and do you have most people talk?
Half the people talk and half the people fall asleep.
Oh.
So our patient yesterday was sneaky. She didn't talk until there was like trivia. And then yeah, like music trivia. She chimed right in. She knew like all the lead singers of the music we listened to. So that gets to hold it and she gets to administer it. But you want a tight seal around it with your lips. You're not going to breathe through your nose. So sometimes you put this little clip here to remind you not to bleed through your nose. So you just keep breathing. Nice tight seal around there. Breathing really strong and full. I had to put my hand up there and I had to feel this vibrating so I know that she's actually breathing it in. And she just, we just wait till she's nice and relaxed. How you feeling? So as you can see, she's nice and relaxed now.
I'm feeling wonderful. It may be worth the price of the full surgery just to feel like this. You guys, seriously, I wish you could experience this.
They can experience, they just have to fly out here and away we go. Okay, couple deep breaths. Give me a tiny little bit of numbing here. 1, 2, 3. And you just keep breathing this way I'm getting it. Do you feel that at all? She says no. That's a tiny little 32 gauge needle, like a flu shot, barely feels it. And then now we use lots of this numbing medicine. We're just gonna flood the full area where we're working with tons of this numbing medicine while she breathes in the nitrous outside.
This area is going to start to feel rather thick and heavy, but you'll still be able to swallow underneath it just like mom. Okay? You're doing beautifully.
I worked in his office since 2012. I've worked with him in surgery centers and hospitals since 2002. I have had the privilege of doing this job for over 40 years, and I love it. It's always inventive. It's always forthcoming. Dr. Maloney is always willing to teach me and train me, has full confidence in me, and in turn, it's just a wonderful aspect to constantly be improving your skills and updating your knowledge every day.
Yeah, and so you assist him pretty much every surgery.
Every surgery.
She's waking up. I can move her around just by gently steering her in the direction that I want her to go. When we finish with the numbing medicine, take away her nitrous. You should wait something or she'll get completely numb, but she'll be talking funny like she's been to the test. All right, give me this. How you feel? How were the injections on a scale of 0 to 10?
When?
How was the nitrous?
Great. Oh my God. Great.
Seems like she's very drowsy, but she's gonna wake up and like be more alert in about 1 minute.
This is chlorhexidine, and it helps. The longer it actually stays on the skin, the more effective it is.
Oh, okay.
And in turn, it helps cleanse the skin and so forth. Now, if something itches or bothers you on your face or your neck, your job is to tell me.
Okay, I've got an itch right under my chin. See, signals so nice.
Oh, God bless you. You're so sweet.
So we're just getting everything set up. We don't do anything that might be uncomfortable without testing you first.
Okay.
It used to be 99% non. Anything that you feel, you simply say, hey, I feel that. Yeah, we're anonymous. Because it's diluted, its safety profile goes way up.
Just getting everything set up here, creating a nice, clean, sterile field, okay?
She's got prominent digastric muscles here. She has a scar band here. We're going to make our incision here to approach the submental area so that we can loosen up and free up the skin and redistribute it to the exact spot that we are. Do you feel anything there? Perfect. And then the fat grafting, we're going to do a couple access points. Can you do it that way? The tiny little spot there and a spot there. So you said there's no surprises. We just check. You feel anything there? So we already put the numbing medicine in there. For a little pilot spot here. And this is a blood tip canvas, so it's nice to want. You're not gonna hit veins and arteries and cause bruising. So that's 3 cc's. And it's already given it a nice contour. And because it's soft with my fingers, it's malleable. I can kind of smooth it around, see that it's exactly where I want it. And so it's already perfect. I mean, I just love it.
This is a fun project. I know I live to funky, but it's fun. You would really enjoy it.
We'll put a tiny droplets all over the place. It's not just injected as one giant graft. It's tiny little droplets. I'm gonna put 1 cc here because this is your smaller side. And so she probably had just a little bit more lib on that side compared to this side. Do you feel anything when I tap here at all?
Well, I'm tiny there.
Tapping, or do you feel something sharp?
A little charge at the area.
So that's why we tested. So I'm gonna give you more right there. So I just supplemented it because you felt it behind it. And the medicine numbs instantaneously. So now we just work away under the neck, okay? Just working away. Isn't this fun?
It is.
Hi, baby. You're looking awesome, baby. You're gonna love this, yeah? You're gonna love it.
That eye feels a little tight down in that corner. Feels a little tight.
It is tight and it's also numb.
That's swollen.
And there's a little bit of swelling there.
Okay.
So there's no question you're going to feel that kind of tightening sensation.
Okay.
So some of it's good because you are tight. And I had to train it just a little bit more. So 100% of people say it feels real tight right now.
Oh, they do?
Yes, everybody says that.
Yeah.
And nobody comes back post-op and says,
It's okay.
these are tiny little 6/0 nylon sutures that come out in a week. And one skin edge is kissing the other. These just approximate so that we can get this to heal as perfectly as possible. This is right along the hairline here. Those hair follicles are growing right into the scar.
This is amazing.
Yeah.
I just in a wake the whole thing and never felt a thing, and it's so interesting because you really learn what expertise is involved. I know you said all my friends and family look fabulous.
Well, so what we're doing here is under local anesthesia. Some people don't like it because they don't have the personality. They don't like talking to their patients. And if you don't like talking to patients, you better hire a first assist that likes to talk a lot. And both Susan and I like getting to know patients. We hear the most fantastic stories of where they're from, how they met their spouse, what kind of work they do. And so that's a lot of fun. We talk a lot more technical today. You know, I feel like I know you guys so well. It's almost like we're friends. So this is just some cold water. We're getting the soap off of her face and getting ready to sit her up and put a dressing on her. All right, so lift your head for a minute.
Okay.
And as I gradually sit you up here, okay, the bed, you're gonna feel like you're sliding down, okay? And now you can start to gradually swing your feet off to the side there.
Immediately after surgery, you can see she's puffy and swollen everywhere. So we've got a nice jawline, nice neck. You've got all these quilting stitches that come out in a couple of days. Staples in her hairline here and stitches around her ears. But most importantly, we had a sharp jawline, beautiful neck. This cord in yours are drained, and that comes out tomorrow.
Doesn't hurt at all.
And so how was your overall experience? On a scale of 0 to 10, what was your pain level?
0.
Yeah. And she talks money like she's been to the dentist because all this numbing medicine all around here numbs up the muscles to her mouth. So she talks like she's been to the dentist, and that goes away in about an hour.
It's just crazy because this is one of the main reasons I found him. And it's a deep plane facelift. It's the state-of-the-art Beth facelift, right?
Yeah, and we have video that shows that.
It's right in front of you, sir.
So this is a light compressive dressing. This shouldn't be tight. It's just
Yeah,
enough just to hold the dressings in place.
okay.
So some people are like, oh, that's too much tension on the skin. Well, there's no tension on it. Just,
Okay, good.
nice, easy way to hold the dressings in place.
Okay.
So let's look at the drain again. We already have a little bit of fluid in there. I don't want any of that fluid in her neck while she's healing the first day. That's why we use a drain. We want any of this numbing medicine to be able to come out.
So I'm supposed to go back to the hotel and relax on pillows, kind of incline.
Yes.
Did it? And how often do I change?
You don't have to change it at all.
Oh, really?
You don't have to measure it. We're taking out day 1 no matter what.
Okay, they're carrying it tomorrow at 11.
Yeah.
What I need to do between now and then that I'm not.
You just need to relax, keep your pain under control, watch some TV.
I could eat
Entertain.
no
You
food.
can eat anything you want.
Okay.
A lot of our patients don't even take pain medicine. You have ibuprofen, that helps a lot. And you'll have no sore throat, you'll have no nausea and vomiting.
Okay. At 11, I'm here, and what are you going to be doing?
We're going to take out the drain and we're going to tell you look perfect.
Awesome. I like the list.
That's what we're going to do.
Okay, thank you. So,
All right.
oh, thank you. Here I am out in the car after the procedure. Alan said he saw it during surgery and that it looks really wonderful. Before it swelled, he saw and he said, my neck has actually looked really good. But I am a health content now. Now I still can't talk. So I will check in later.
Proceed to
Okay.
present payment trios.
Well, that was a look at my complete surgical experience getting the Maloney Deep Plane Facelift. I think it turned out very well. And if you have any questions, just leave them in the comments section below the video because maybe we can get him on the channel to answer some of those questions. And before you go, if you haven't seen my blepharoplasty video yet, I hope you'll stick around.